Hello, I'm Maruk Said, your microbiology guide. Let's explore in-depth micro techniques and uncover groundbreaking insight together on this educational journey into the fascinating realms of microbes.
Cholera is a transmissible infection caused by the bacterium Vibrio cholerae, which can lead to severe gastroenteritis and profuse watery diarrhea lasting for several days. Rapid dehydration and electrolyte imbalances can become life-threatening, as suspected in the deaths of James K. Polk, the 11th President of the United States, and Charles X, King of France. Vibrio cholerae is a gram-negative, curved bacterium that appears as small red or pink, comma-shaped organisms on a gram stain. It is oxidase positive and thrives in alkaline media. It possesses pili and a single polar flagellum, resembling a tail, at one end, which it uses to move through the gastrointestinal tract. As a facultative anaerobe, it is capable of both respiratory and fermentative metabolism. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. Transmission of Vibrio cholerae typically occurs via the fecal-oral route. This includes ingesting untreated sewage-contaminated water and anything exposed to it, such as raw or undercooked fish, including shellfish, as well as poor hygiene practices, like failing to wash hands after a bowel movement. Cholera is more prevalent in developing countries and regions without advanced sanitation and sewage treatment systems, with high incidence rates in certain parts of Africa and South America. Individuals with low gastric acidity or blood type O are especially at risk for developing a severe infection. When Vibrio cholerae enters the stomach, it suppresses protein production to conserve energy and nutrients, helping it survive the acidic environment. Once it reaches the intestines, V. cholerae uses its flagella to move toward the intestinal walls, propel through the mucus layer above the epithelial cells, lining the intestines, and attach to the finger-like projections called villi on the surface of these cells. At this site, Vibrio cholerae begins to multiply and produce toxins. Although V. cholerae itself does not invade the epithelial cells, its toxins do, and they can cause significant disruption. The exact toxins produced can vary depending on the strain of Vibrio cholerae. Some strains produce toxins that cause no symptoms or only mild clinical effects. However, certain strains produce cholera enterotoxin, also known as choleragen, which is most commonly responsible for significant clinical symptoms. When cholera enterotoxin enters the epithelial cells, it triggers ADP ribosylation of the GS-alpha subunit of the G protein. This modification causes the G protein to become permanently active, continuously stimulating a membrane-bound enzyme called adenylate cyclase. As a result, adenylate cyclase causes excessive production of the intracellular secondary messenger cyclic adenosine monophosphate, or CAMP. The increase in CAMP prompts chloride channels on the cell surface to secrete more chloride into the intestinal lumen, while simultaneously inhibiting channels that normally allow sodium and chloride to re-enter the cells. This abnormal elevation of luminal sodium and chloride disrupts the osmotic balance between the intestines and surrounding tissues, causing water, bicarbonate, and potassium to flow rapidly into the intestinal lumen. This can result in symptoms such as vomiting and large volumes of watery diarrhea containing extremely high concentrations of sodium, potassium, chloride, and bicarbonate, along with high levels of live Vibrio cholerae capable of infecting others. There may also be flecks of the intestinal mucus layer in the stool, resembling grains of rice in water. Typically, fever, pain, or cramping are absent. While the incubation period for V. cholerae can range from a few hours to 2 to 3 days, severe dehydration and electrolyte depletion can occur within just 4 to 12 hours after the initial episode of diarrhea or vomiting. These imbalances can cause symptoms like disorientation, dry mouth, swollen tongue, sunken eyes, cold, clammy skin, and shriveled or dry hands and feet. Even more serious and potentially fatal complications can arise due to loss of electrolytes and water from the bloodstream. For example, low bicarbonate levels can result in metabolic acidosis with deep, labored breathing, known as Kussmaul breathing. Low potassium levels can lead to muscle dysfunction, such as leg cramps, weakness, and irregular heart rhythms. Deficiency in chloride and sodium can cause headaches, poor balance, disorientation, seizures, and coma. Ultimately, severe dehydration may progress to hypovolemic shock, marked by a significant drop in blood pressure. Diagnosis is typically confirmed by culturing a stool sample on thiosulfate citrate bile, salts, sucrose TCBS, agar to grow Vibrio cholerae. However, even before a definitive diagnosis is established, the primary treatment is the rapid replacement of lost fluids and electrolytes using rehydration salts, administered either orally or intravenously. In cases of mild to moderate diarrhea, this supportive therapy is often sufficient, and symptoms usually resolve on their own within 3 to 7 days. More severe cases, however, may require antibiotic treatment. In such instances, the stool culture can guide the choice of the most effective antibiotics, which may include tetracyclines, ciprofloxacin, afloxacin, furazolidone, or trimethoprim sulfamethoxazole. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. To recap, cholera is a contagious and severe form of gastroenteritis caused by the gram-negative bacterium Vibrio cholerae. Its transmission occurs via the fecal-oral route, typically through the consumption of contaminated sources like water and shellfish. Certain strains produce cholera enterotoxin at the surface of intestinal epithelial cells, which results in the overactivation of CAMP by permanently activating the Gs alpha subunit. Patients commonly present with profuse rice water diarrhea, which can rapidly cause dehydration and electrolyte imbalances, potentially fatal without prompt treatment using rehydration salts.